So we'll go on then to Mr. Michael Landau, the CEO of CTI, Introduction to CTI Africa and leading the fundraising campaign for this sickle cell disease.
Okay, good morning, everybody. Thank you very much. And I'd like to start by thanking Moses Mulimura, from the Uganda UK Health Alliance for putting together this program. And I'd like to thank our friends at the, especially Dr. Diana Twini and our friends at the Ministry of Health. And I'm, without going into too many, thank yous, and I'm sure I'm going to be missing other people out, but I think, it's an honor to be here. And Moses, with the work that you do with Jed and Byrne and with Lord Crisp, just, keep going, because it's very impactful and it clearly makes a massive difference. And all of these, whatever it is we're discussing here, will be shared, amongst many, many people going forward. And these are very critical messages. CTI Africa is a social enterprise focused on empowering people, nations with technology. And CTI's main focus using the technology is primarily in the areas of agriculture and healthcare. We've launched our own smartphone called Life Mobile. And as I was, and with our healthcare program, which again, our program is a very comprehensive digital healthcare platform, which enables patients and doctors and hospitals and clinics to be completely online and digital. We have a very comprehensive telemedicine solution. And as I was, as you can see, I don't come naturally from Uganda, but having been working in Uganda now for almost 20 years, and in Africa, sickle cell anemia, you can't avoid it. And it's unfortunately one of those subjects that, kind of you hear them almost like whispered. You don't really hear them, out loud, but, somebody's not feeling well, they don't come into work for a few days. Oh, well, the sickle cell. So, and then and especially because of COVID, and we worked closely with the Ministry of Health, we've developed some apps for COVID. And hopefully they'll be adapted much more than they have been so far. But I'm sure some of you are familiar with the Katoto story that came along with the COVID. And now we did so we've also very keen on explaining to people and using communication tools, which we've done, kind of using the Katoto and other cartoons, which we've just done now with the Ministry for Malaria. And I recognized, and within our team at CTI, our Life Health Network team, we recognized that under COVID, getting to the doctor was clearly a lot more difficult than it was before. So the demand and the need for using telemedicine became even more apparent. And again, as we were understanding the life of the people with sickle cell more, it became even more apparent that this segment of the community is going to be able to benefit far more from having the ability to use their phone to be able to communicate with their doctors. Now, in addition to that, even, as we started to research a little bit more about sickle cell, I was approached by a friend in Malta, Dr. Joseph Borg, who's doing research, for sickle cell anemia. And then I mentioned to him about, the work that we were starting to look into to do in Uganda with sickle cell. And then we discussed also about the fact that there's a major lack of information, and it's designated as an orphan disease in the United States. I'm not very familiar with exactly what's happening, kind of in the UK and other countries, but it's an orphan disease, which means that even though there are 2 million people around the world suffering from it, and according to some accounts, 20,000 babies a year in Uganda, and I thought, how terrible! How can a disease that affects so many people around the world be regarded as an orphan disease? And so when I started to look into what data was available, what groups there were of, what research was really available. And I mentioned this to my friend, and I said, if we could put together, kind of 10, 20,000 patients where we can collect because within our program at CTI, within our Life Health platform, we onboard our patients by taking their medical history, by taking their vital signs, by taking their bloods, and then we continue to monitor the patients beyond. I said, if I could put together a group of 10, 20,000 sickle cell patients that we could monitor, he said, Michael, that would be way beyond what anybody has done anywhere in the world. And now with technology, it's not a difficult thing to do. So then we started engaging with Ministry of Health, and then with and especially with the Uganda Sickle Cell Society, or Rescue Society, who is, I forgot, they were the one group that I should have mentioned, right at the beginning. So I knew the minute I start, I'll make mistakes and not mention somebody. But that organization, they're absolutely terrific. And when we started sharing with them our platform and our ideas of what we wanted to do, they were, extremely encouraging of our ideas. And again, as we started, I live in New York. My brother, Dr. David Landau, is in the UK, and he was, also quite familiar, with the sickle cell disease. And then one other factor is that in the Jewish community, we have a disease in the European Jewish community called Tay Sachs. As we say, God forbid anybody should have it, but if God forbid a family has it, children die by the age of 2 or 3, and it's beyond horrendous. And back about 35, 40 years ago, there was a rabbi in New York who lost 4 children to sickle cell. And he decided that God has sent him his calling to identify what was the root cause of sickle cell and how can he eradicate sickle cell, Tay Sachs. And how can he eradicate Tay Sachs from the Jewish community of European descent? And he created this registry. And on this registry, people would go and get tested, and they would have their information on the registry. So today, before any young couple gets married in the Orthodox European community called Ashkenazi community, they get tested. And they match up, the young man and the young woman before they get married and before they commit to have children. And because of his focus and his activity, Tay Sachs has basically been eradicated from the world. And I thought to myself, sickle cell, which thank God is not it's survivable. And today, there's even some medication for it. But why can't we do the same thing? Why can't we create a registry for sickle cell and start with sickle cell, and then start in Uganda and then evolve around Africa and make it a worldwide program? So we in our discussions with the Ministry of Health and with the Uganda Sickle Cell Society, decided to put together a fundraising campaign focused on 3 main areas. Area number 1 is that we'll be able to provide smartphones and our Life Health platform to sickle cell warriors, so that way they and their families won't have they'll be able to receive world-class medical services from wherever they are, whenever they are, and be able to monitor their health. Number 2, we decided that we need to be able to create a center of excellence for research and development, which we're doing in partnership with the University of Malta. We're going to be doing it in partnership with the Ministry of Health, with the National Health Laboratory. And we really need to put together, a lot more of a focus on the research and development, because unfortunately in Uganda, the numbers exist and the patients exist to be able to to make some very solid determinations, to be able to come up with solutions. But most importantly, we are going to be launching a registry. And with this registry, we want all people to be able to be tested. And that way, before they get married or commit to have children, it's a very easy test to be able to see if somebody's compatible or not compatible. And then hopefully people will be responsible enough to know that if both of them have got the recessive gene, which is required in order to be able to pass on sickle cell from one generation to the next, people will therefore refrain from getting married or having children, because they shouldn't be taking that 30% risk of bringing a sickle cell child into the world. And I'm sure they'll find love elsewhere, which has happened, very well in the Ashkenazic Jewish community with the eradication of Tay Sachs. So we are at CTI, where we've been having discussions with people from the White House and people who had an event a couple of weeks ago. We're in discussions with, the senior management at the United Nations, and we already had a discussion with the UN ambassador the Uganda ambassador to the United Nations about doing a similar program, and really doing our best to make this into an international campaign, and doing our best to make sure that we eradicate sickle cell as a disease. And we're very honored to be a part of, a group of people over here. And Michelle, it was a very emotional and very well presented case that you're explaining about what's going on in the UK. And I hope we'll be able to collaborate and somebody will share our information together. But we're looking to make this campaign a major international campaign. I've reached out to large groups where they've got hundreds of thousands of students on the groups, and we've created this concept of the power of 10. I think this is something which is a completely humanitarian responsibility for all of us to once and for all make the effort to eradicate sickle cell from the world and then go beyond to other genetic diseases. So, we are here, we are committed. I've already on the website, if you've been, where we did a bit of a soft launch. I already gave a personal donation, which you guys can go and check on our website to see how much I gave personally. But now I'm committing to an additional $10,000 from CTI to kick off the corporate side of the campaign. And we welcome and encourage everybody, certainly on this call and beyond, to make this an international cause. And if people can come up with the Sickle Cell Challenge, I don't understand social media very well, but they've got these social media challenges where, do this challenge. So let's create the Sickle Cell Challenge. Let's get at least, kind of everybody of African descent excited and talking about this program. Let everybody who's got a heart, anybody who's got any amount of sympathy and empathy for these sickle cell warriors and the families, so let's get behind this campaign and let's make history and let's eradicate sickle cell once and for all. So thank you very much for all the organizers.
Thank you. Thank you, Michael. And that is a great contribution, especially and very exciting campaign that CTI and partners amongst this call that are going to be part of. We encourage other private sectors, individuals to also take part in the fundraising campaign, especially in terms of where the funds are going and creating this registry for sickle cell warriors and telemedicine services that can really help with reaching out to warriors across the country.